Hello everyone, this is Dr. Jerry Cowart speaking. Today we're going to be speaking on shoulder and neck pain. So in this lecture today we're going to be covering some statistics about who all gets affected with neck and back pain. We'll talk about that Triad of Health that we often talk about in our office, that structural, chemical, and emotional balance. We're going to be talking a lot about anatomy of the neck and the shoulder because it's hard to understand the different issues that arise within the neck and shoulder without understanding what's all in there. And then we'll talk about common issues that affect mainly the shoulder, and then treatment options that you may experience both on the medical side and on the natural holistic side as well. So let's start off with a little bit of some stats here. So I don't need to read off all this to you. I'll let you pause this if you like and read to it. But what was interesting is that how often we see neck pain within the chiropractic office. And then also more commonly females are experiencing neck and shoulder pain. I think that could be because females typically end up complaining about it, whereas the stereotypical male usually just kind of, it'll go away on its own. One of the things to note about these stats, especially in the neck pain side, is that it's actually a very high prevalence. But if you think about it, how many people do you know that experience some neck pain or some shoulder pain, but expect it to go away and don't ever really get it sought out? So I'd expect these numbers to actually truly be higher than what's actually reported. And you can see that there's actually a fairly decent percentage of the pain that never actually goes away and becomes chronic, or maybe goes away but then comes at a later time. So this is definitely something that is not uncommon to see, both in the chiropractic side and nutritional side and acupuncture side, but the medical profession, I'm sure, sees a lot of this as well. So in our office, as chiropractors, we focus on what's called applied kinesiology. Kinesiology, study of movement, so therefore the muscles in the body. And applied meaning we're applying it to different regions and areas of the body. With applied kinesiology, or A for short, it's basically founded on the principle of the Triad of Health, meaning anything in the body that is wrong, like some sort of issue, is caused by one or more of three things: either structural issue, emotional issue, or chemical issue. Your structural issues are the things that you can physically touch within the body. So we're usually talking anatomy here. So usually it's some sort of injury or trauma that has happened that affects the structural balance within the body. The second piece is chemical. So that's usually anything exogenous, anything outside of the body affecting the inside of the body. So that could be chemicals, so actually like pollutions or heavy metal buildup, or environmental factors like pollen or allergies, things of that nature. But it could also, and more frequently, be more dietary related. So any kind of foods that you're eating. So the general rule of thumb is, junk in gives you junk out. Nutrition in gives you good functional processes out. So you basically are what you eat, so to speak. And then lastly is the emotional component. We hear it all the time, especially with this topic of neck and shoulder pain, is, oh, I carry all my stress in my shoulders. So that I have an evil boss at work that's really mean to me, and then I get really tense, and then my shoulders start to ache, or there's stuff going on at home with a spouse or kids or whatever the case may be. So there's definitely emotional components as well that can affect the rest of the body. We'll briefly talk about some of the chemical and emotional things. Obviously, with it being shoulder and neck pain, most of what we're talking about today is going to be on the structural side of things, but we will talk on the other two as well. So as I mentioned before, with applied kinesiology, we see muscle function and we relate it to different other systems within the body. So with AK, we see that there's a muscle and organ relationship, as you can see here on this slide. So with the upper trapezius muscle, that muscle goes all the way from the base of the skull and it attaches to the end of the neck and also out towards the end of the shoulder. And that relates to eyes and ears. You have your subclavius muscle, which we will talk about further in the lecture. It's a muscle right underneath your collarbone, and that relates to stomach. And then you can read through here the other muscles and their organ relationship. Well, each organ has its own responsibilities within the body and therefore will have its own individual nutritional requirements to be able to function more optimally. So you can see here a list of different nutrients or supplements that would be important for some of these issues. With this being said, it does relate to the fact that sometimes with actual neck or shoulder pain, you may not necessarily have the structural component like injury that happened that caused these pain or dysfunctions, but it could be an issue within the related organ that is being reflexive, causing some of these pain patterns within the shoulder. So it's always good to look at other systems outside of just the pure structural component because it may be more deeper than that. All right, so the next part of that triangle is the emotional piece. So like I mentioned before, there is the muscle and organ relationship, but there's also emotional components that also relates to certain organ functions as well. Some of it is based off of acupuncture, ancient Chinese medicine. And again, I don't need to read these to you. They are listed here as some of the common ones that we see that are more so specific to the actual shoulder and neck itself. Muscles like the deltoid muscle, the latissimus dorsi. We will be speaking about the latissimus dorsi muscle a little bit later. Another huge one that we see is the teres minor muscle related to thyroid function. That whole stress pattern, that emotional component is definitely something that cannot be overlooked in relationship to neck and shoulder complaints. So here's just another piece to it that we look at when we're evaluating a patient. All right, so this is the part where I think it's every chiropractic favorite part of any kind of topic is the structural component. So we're going to be talking about the anatomy of the shoulder. The shoulder is very complex, as you can see here, just from this short list. It's very dynamic with the types of inner working mechanics within the shoulder. So you can see that there's 3 joints and there's one quote-unquote pseudo joint, meaning that it's not a direct articulation between 2 bones, but it moves and acts very much like a joint, and we'll go into that a little bit further. There's a huge network of nerves that come out of the neck into the shoulder, so this is why we can never ignore the neck when dealing with any kind of shoulder pains and vice versa. And again, we'll be going into that further. And there's 6 bursa, so a lot of times this is where you get inflammation patterns and like kind of achiness going on with those types of pain patterns. And there is a lot of muscles within the shoulder, and a lot of them do the same or similar functions. So when one breaks down, you have another one start to recruit and compensate. So we'll be breaking each one of these 4 boxes down into more smaller components. So the first part of the anatomy of the shoulder is going to be the joints themselves. Obviously, this is what main chiropractic is looking at, is actually the joints and how they move and how they can be misaligned, or that word that we talk about all the time, subluxations, meaning those small misalignments in between vertebrae that impairs neurological function. So you can see here that sternoclavicular joint, and then the acromioclavicular joint, and the glenohumeral joint. Those are your 3 main articulation or joints within the shoulder. That one pseudo joint that we talked about is that scapulothoracic joint. So the reason why that's considered a pseudo joint is because basically your shoulder blade or your scapula just glides across your rib cage and doesn't actually form a true joint, but it can definitely get malpositioned, misaligned. It can get stuck. It can get adhesed in between the muscles that are around that joint, and definitely acts very much similar to any of the other joints. So when there's a disruption or derangement within that quote-unquote pseudo joint, it can still have a huge impact to the rest of the shoulder, just like any of the other true joints can. Next up in our mini anatomy lesson, if you will, is talking about the nerves that innervate the shoulder. The biggest part or takeaway from this is actually the involvement within the neck. So this is why we can't not talk about the neck in relationship to shoulder pain, because all of the nerves that come into the shoulder and therefore down the arm and into the hand all originate within that cervical spine or within the neck. So you can see there on the right hand side of this picture, you've got the vertebra or the spine that is part of your neck, and you can see C5, C6, C7, C8, T1, all that is coming from the neck. So those nerve roots come together and form this giant net and webbing of nerves called your brachial plexus, brachial meaning arm. And then after they get done forming and dividing and coming together again and dividing again, you get 5 main nerves, as you can see on the far left-hand side of the picture, that will then, snake their way down the rest of the arm and into the hand. So this is why checking the neck first and foremost with any kind of neck issue should be the practitioner or the physician's first concern and priority to be able to fully assess what's going on with the shoulder pain. So next up is the bursa or the bursae of the shoulders. There's many different bursae here, and there's actually even more that's not listed that are kind of smaller bursa, but basically think of a bursa as kind of like a pillow for a joint or for tendons. It allows for smooth passing when the joint or the part of the body is moving and its various actions or ranges of motion. And when there is some sort of derangement within that area, so in this case the shoulder, when there's some sort of derangement within the shoulder, that's when you can get inflamed bursa. So that kind of deep achy type feeling, the hot burning feeling. Sometimes it's involved with impingement syndrome, which we will talk about later. So that's where a lot of your inflammatory processes come from, those pain patterns that you typically see in shoulder pain. So as an applied kinesiology doctor, this is where I really get excited about the anatomy and the complexity of a joint, especially within the shoulder, is the muscles. So I've kind of identified 5 muscles that I think are commonly overlooked or maybe not completely examined properly, whether it be within the medical field or within other kind of basic chiropractic offices. So we're going to dive in a little bit further in these 5 muscles here. And first up is that subclavius muscle. This is one that I mentioned earlier. It is located underneath the clavicle, or which is your collarbone. So it actually rotates the clavicle or that collarbone as part of the initial action of raising your arm, especially raising it out away from your body. So if it's tight and constricted, it can really just lock down the shoulder. It can cause a lot of pain patterns. It will decrease a lot of your motion anytime you're trying to, say, lift your arm up to reach something in the cabinet or kind of reach behind you or try to reach something out to the side of you. It really locks down that shoulder and really makes it difficult to achieve those actions that you're trying to create within the shoulder. Like I mentioned before, it does relate to the stomach. So a common visual pattern that we see that could be affecting that subclavius muscle would be what's called a hiatal hernia. That's when, on a lighter term, that's when they top of that stomach gets attached and stuck or adheres onto your diaphragm, which is that muscle that helps the lungs expand and contract to be able to breathe. And in extreme cases, that actual hernia, the stomach can get stuck within the diaphragm itself. So that would be like a mechanical structure within the viscera that could cause these types of shoulder pain. Obviously, dealing with the stomach itself, sometimes it could be a decrease in stomach acid. That's what your HCl is, hydrochloric acid. So sometimes patients need to be put on, temporarily some sort of stomach acid production supplement to be able to break down foods easier. And that in turn can also be reflexive into some shoulder pain within that subclavius muscle. This is definitely one that I find really commonly, and most of the time you can have like an asymptomatic shoulder dysfunction and you go in and you palpate right underneath your collarbone, your clavicle, and it'll be tender. It's tender on most people. So this is definitely one that I think gets overlooked very commonly. Another muscle that I think gets overlooked or maybe misevaluated very commonly is the levator scapula muscle. So the reason why this muscle is so important, and this goes back to a previous conversation we were having about the importance of the neck in relationship to its shoulder, is that this particular muscle actually attaches from the bones of the neck itself and attaches onto that shoulder blade or the scapula, and it helps raise the shoulder blade up. That's how it gets its name, levator, to levitate or to rise, scapula, the scapula. And so with this, any kind of derangement or issue within this muscle can have an effect on the neck, or it can have an effect on the shoulder, or it can have an effect on both because of the relationship between the two. So the issue with this one is that there's so many people with thyroid dysfunction, and when you end up having an issue with the thyroid, you can also end up having an issue with the parathyroid glands that sit basically right along that thyroid. So this particular muscle relates to those parathyroid glands, which does deal with calcium balances within the bones and within the blood. And so any kind of issues with the parathyroid glands can end up leading to things like osteoporosis. So sometimes when someone comes in and complains of like, yeah, my neck is really tight and tense, and so is the top of my shoulders too, sometimes it is worth looking at, what's going on with their calcium. Is there any chances of osteoporosis? It's got to be something that gets looked at and evaluated, that can't just be overlooked, unfortunately. And I do see that sometimes that does get overlooked. Almost always, if there's an issue within the neck and the shoulder at the same time, this muscle is definitely going to be involved. Okay, I put the latissimus dorsi muscle in here. It's a big muscle, as you can see by the picture. If you look at, say, like a swimmer and you see the giant fan muscles on their back, that's their latissimus dorsi. It really helps with that rotation, so that kind of butterfly swimming motion, that's a lot of the latissimus dorsi action. It's a big muscle, so it doesn't necessarily get overlooked often. There's two main reasons why I put it in here, is that sometimes, because it mainly originates and attaches from that lumbar spine, that low back, as you can see how it has all that fascia connection into the sacrum and into that lumbar spine. So sometimes there can be a shoulder issue and a low back issue as opposed to a neck issue. And then this would be when it would be appropriate to look at that muscle. But another reason why I put this muscle in this group of commonly overlooked muscles is because of its relationship to the pancreas, so therefore blood sugar handling. As you guys are, I'm sure, well aware at this point, diabetes is extremely prevalent. So there's a lot of blood sugar handling issues, especially within the United States. So sometimes people who have diabetes can also end up getting, shoulder pain that they don't understand why they have shoulder pain, because there was never any trauma or injury that would have caused pain into the shoulder. and this could be the cause for it. So this is why I say it's kind of overlooked, because of its organ relationship. And I have seen this several times where someone who is diabetic and they show up because they have shoulder pain and they don't know why. And I'm checking their history, I'm looking at their paperwork, and they have a really high A1C, or they're on metformin or something to that effect. And that ultimately was the source of the shoulder pain, and we basically end up treating it completely differently than how you would assume that a chiropractor would treat a shoulder pain. So ladies, this muscle is kind of for you. Typically when people have that complaint of, oh, it hurts to reach behind me to unhook my bra, it's kind of pathognomonic for a dysfunction within this coracobrachialis muscle. And I put this muscle in there because of the fact of its actions. Its action is flexion and adduction. So flexion meaning it raises your arm up in front of you, and adduction meaning it brings the arm closer to your body. So that forward action, that bending action, a lot of it is biceps will do that. So that's a common muscle that people tend to think about when they're, say, like weightlifting or whatever. They want to do bicep curls, or that adduction could be part of the pectoralis muscle. So everyone wants to do like bench presses to have a big chest. Well, what they forget about is this little tiny muscle, the coracobrachialis, that also does both of those actions, that could be kind of lingering in the background that people often forget about, that could be also causing a lot of these shoulder issues. So the unable to be able to reach behind you for some reason, like get something in the back of your car, or like I mentioned before, the unhooking of the bra, that also can all be a part of this. And then I put in AC dysfunction. No, that doesn't mean air conditioning. AC is relationship to that joint that we talked about a while ago, called your acromioclavicular joint. So it basically will hold down that joint, and it won't allow it to be able to move properly as well. So that could cause some sort of subluxation or inhibition within that joint pattern as well. So it's definitely one that is kind of like the subclavius, where it's small but very pesky when dealing with shoulder complaints. So the last muscle that I have here in this kind of group of overlooked muscles is your serratus anticus, or serratus anterior, as the newer nomenclature states. So if you looked at a bodybuilder and you see those muscles kind of on the side of their rib cage that look like ribs or like fingers, that's your serratus anticus muscles. The main action of these guys is to keep that shoulder blade, that scapula, onto the rib cage as it's moving. So when we're talking about that thoracoscapular junction or joint that we talked about, that pseudo joint, that's what this muscle does. It helps keep those muscle, or that bone, the scapula, onto the rib cage and allow it to move properly. We see oftentimes that these muscles just aren't firing properly because they're usually underworked, under firing, and they're very weak and need to be strengthened. So the big classic case with this is if you ever notice someone's shoulder blades and they go to reach or punch or do something and you see it kind of winging out, like it's not staying onto that rib cage flush, that's this muscle. That's an issue with this muscle. One other thing to point out, especially with this time of year where you got flu and cold going on, you've got COVID going on, allergic reactions where a lot of people are coughing and sneezing, and people are wearing masks, so sometimes it's like difficulty breathing. If you notice that a few of these muscles that we've talked about, the organ relationship to these muscles is dealing with the lung. So anytime people are having like the pneumonia or any kind of lung issues, asthma or something like that, oftentimes they may have shoulder pain. That, again, is that I don't know why I've got shoulder pain, but I do, even though there was no trauma. So it could be any combination of these muscles and others that could be a contributing factor to what's going on within the shoulder. Now, since we've gone through the anatomy of the shoulder and the neck, now you guys are more equipped to be able to talk about some issues that can happen in the neck and shoulder. So when all those anatomical structures aren't working optimally like they're supposed to, these are the issues that could arise from that. So let's start by talking about the thoracic outlet syndrome. So your thoracic outlet, as you can see in this picture, is the opening from where that first rib and the neck and the clavicle open up, and you have all of those nerves, which is the yellow ribbon that you see, and then your artery and vein that you see in the red and the blue all pass through, okay? So there's three main ways that there can be some sort of entrapment or derangement within that thoracic outlet. When you have any of these three methods, basically what you're looking at is there numbness or tingling into the hands? Do you feel like your arm just feels weak? Is there pain patterns? Because there definitely can be pain patterns within that shoulder or like at the base of your neck, like the crook of your neck, right where the neck and the shoulder meet. So the first part is scaling. So that's going to be those three muscles that you see there. So they, again, also attach to the cervical spine and to those vertebrae, and they also attach to the top of the first couple of ribs. And if they get tight or constricted, usually by small repetitive motions or traumas, so maybe an automobile accident can do it, maybe improper work ergonomics can do it, maybe you have the wrong size pillow while you're sleeping. If you're a side sleeper, that can do it. Text neck can also cause this, so having that anterior head carriage, as we call it, or basically the kind of turtle head where the neck is just kind of pushed forward away from the body, all of that can constrict those scalenes, and which in turn can also constrict and apply pressure and pain to those nerves that come out that we've already talked about, that brachial plexus. So the second thing that could also cause the thoracic outlet syndrome would be the first rib. So we talked about how that outlet is in part made up by that first rib at the top of the rib cage. So if that rib is subluxated, again, the malposition, misaligned subluxation, if that's subluxated, that in turn can also decrease the space that those nerves are going through, which in turn can also cause the pain patterns and things of that nature. And then I listed on here extra stuff. So sometimes there's what's called anatomical variance, meaning you were born with like an extra part, or maybe anatomy just grew a little bit differently than what is, say, textbook in a sense. So the most common would be an extra rib. They call it a cervical rib. So your first rib attaches from your first thoracic spine, which is the back of your back, basically. Sometimes that cervical rib actually originates from the last bone of your neck, of the cervical spine. So with that extra bone being there, that can in turn also apply some pressure onto that brachial plexus, or those arteries and veins. And there's obviously some other minor sinister stuff that is super less common to see that would be categorized into that extra stuff. But thoracic outlet syndrome, being part of that neck and shoulder complex, in of itself is a very complex thing to be able to diagnose, because many different things can classify all under thoracic outlet syndrome. So the next one is impingement syndrome. This is definitely one of those where you may have heard the buzz term overuse injury. So impingement syndrome, meaning something is impinged, something is trapped, something is compressed. So right underneath that acromion, which is an extension from your shoulder blade, and where it attaches to that clavicle, so that's that AC joint that we talked about before. As you can see in this picture, you have that subacromial bursa, and then you also have a muscle and tendon from your supraspinatus muscle, which we will talk about a little bit further, and then that whole entire rotator cuff. All of that goes underneath that AC joint, acromioclavicular joint. So then when there's some sort of derangement, overuse, inflammation, subluxation, dislocation, any of those things that's potentially going on into the shoulder, when you go to lift up your arm, to, again, reach up something in the cabinet or to get something off of like your visor in your car, anything that is lifting your arm upward to do, it can be all impinged or trapped underneath that acromioclavicular joint, causing pain patterns, and that's why you may have difficulty reaching up, or there may be pain with reaching up. So we talk about that painful arc. So basically, as you begin to raise your arm, and you start from basically where your arm is hanging by your side, and then you start to lift it as if you're trying to make a giant circle with your hand, or like a semicircle with your hand, trying to raise it up as high as you can up above your head. At some point, there's a certain degree where if you start getting pain at a certain degree of raising it, that will give us a clue as to which structures are involved within that pain pattern. So if it's within 60 to 100 degrees of lifting up, it's usually that supraspinatus muscle, which is the most common muscle to be injured for a rotator cuff tear, which we'll talk about a little bit later. And then if it's all the way to the end range, when you can get it just about above your head, and that's when it starts getting painful, then it's probably that actual joint, that acromioclavicular joint itself, that's the pain patterns. And then there's other things that's in between those degree markers that it could also be contributing to this impingement syndrome. Next up is your what I call itis. So itis, the ending itis meaning inflammation. So the two main types of itises, if you will, that we're looking at in shoulder dysfunction is either a bursitis or tendonitis. So as a practitioner, it's always important for us to distinguish the difference between, is this pain coming from a bursa or is this pain coming from a tendon? Because you would treat these a little bit differently. Some of it, because it is inflammation based, there's going to be some overlap in how you would treat it. But overall, it can be a little bit different. So whenever you lift your arm, and it hurts when you start to lift it, and it hurts the whole time as you're moving your arm, that's probably going to be a tendonitis, because you are actually activating those muscles, which in turn will be pulling and tugging on those tendons, which is going to make that pain pattern hurt worse. So if I were to, as the practitioner, lift up your arm, and that's when it starts to hurt, then it's probably more so a bursitis, because you're not activating any of the muscle patterns. I'm lifting your arm and it still hurts. So then that's probably going to be a bursitis, because that bursa is going to be inflamed no matter if you're moving it or if I'm moving it, it won't matter. Because they are inflammation patterns, some of the things that we would use to treat this, these conditions would obviously be ice. You wouldn't want to use heat, even though it may make it feel better, because heat will actually bring on more inflammation, so it would actually potentially make the issue worse. You can use attended ultrasound. So your diagnostic ultrasounds is different than your therapeutic ultrasound. The diagnostic is obviously where you can see a picture, like, you know, if someone's pregnant, whereas the therapeutic ultrasound, using the sound waves, actually it works like a micro massage in a sense. So it calms down the muscle. So if there's, you know, a tendonitis, it can help calm down the muscle and the tendon, and then it will also, you know, push out the inflammation out of the target area with those sound waves as well. We did talk about the fact that with tendonitis, oftentimes it comes from some sort of overuse to the muscle where the tendon is attached to. So sometimes muscle balancing is what is needed, and of course, you know, chiropractic adjustments, because the nervous system going into the muscles. And then a couple of anti-inflammatory foods. Pineapple, specifically the core, has really great anti-inflammatory properties. Turmeric is good as well, and there's plenty of other actual like supplementation that can be given that have anti-inflammatory properties. And as promised, here is the rotator cuff that I said that we would end up talking about. With the rotator cuff itself is actually made up of 4 different tendons that arise from 4 different muscles. As you can see here, you have your supraspinatus, you have your subscapularis, you have your infraspinatus, and you have your teres minor. So the reason why there's stars beside the supraspinatus, and for those of you who've been listening through probably suspect, is that because this supraspinatus is the most common muscle to be involved with a rotator cuff involvement, whether it be an injury or a straight up tear to the rotator cuff, usually it's going to be that supraspinatus that is involved. And going back to our conversation about impingement syndrome, that's the main reason why the supraspinatus is most commonly involved, is because of that narrow opening underneath that acromioclavicular joint, and it makes that supraspinatus more prone to injuries or involvement or tears dealing with the rotator cuff. Oftentimes this is chronic wear and tear to the shoulder if those muscles aren't balanced properly, whether like one is overworked and one's not working properly at all, due to many different reasons. Could be chemical, structural, emotional, what have you. It will in turn cause this rotator cuff involvement. So it can be more, or I should say, less clinically based than a true tear. It could just be dysfunction, and it still can be rotator cuff involvement. I think this one with degeneration is a really huge trigger topic for a lot of people, especially the older you get. Obviously, there's going to be more degeneration, especially nowadays, which is unfortunate because a lot of degeneration I feel like can be avoided, because it happens because there was issues earlier in life that was left untreated. The first 4 bullets here are the levels of degeneration. First, you have the cartilage that starts to wear away because degeneration happens from an abnormal misalignment, so therefore an abnormal wear and tear on the body. So therefore the cartilage is going to be worn out in areas that it wasn't really intended to be overly used, if you will. And then because the body is extremely smart and also kind of dumb at the same time, the body says, oh no, I'm losing cartilage, so I need to lay down something to help cushion the blow to repair what has been lost. So it does what it does best, and that is putting down more bone. And that's where you get those bony spurs. And that in of itself is basically, imagine sandpaper rubbing against sandpaper. It's going to be really, really harsh, and will also continue to degrade the cartilage even further with the bone spurs, because it's almost kind of like a saw going back and forth. And then because you have the breakdown between the cartilage and the bone spurs, that joint space itself starts to narrow. It starts to get smaller. The synovium that is being wrapped around the joint to help cushion it and provide nutrients to it starts to get lessened, and that's where you get a lot more of that bone-on-bone issue. And then because you got complete like bone-on-bone issue, that's when the joint truly starts to just get destroyed. It gets whittled away. The surfaces, especially like in the shoulder being a ball and socket where it's supposed to be nice and round and pretty, can start getting flattened and dumbed down, and that joint really does get destroyed. But sometimes it's not just in the shoulder itself, but you can actually get degeneration within the neck itself that can in turn cause shoulder pain, and that goes back to the conversation of the nerves that come out of the spine. Real quick before we move on to that, I do want to make this a PSA since I mentioned the synovium fluid, and we're talking about the destruction of degeneration. One of the best things you can do to help either prevent degeneration or to help the progress if we're treating degeneration is to hydrate yourself. Drink more water. That only helps provide more cushion, more synovium. And when on the next slide, when we're talking about cervical degeneration, I will harp on again water. So if you're listening to this now, go get yourself a glass of water and have yourself a nice glass of water while you're listening to the rest of this, because we need to make sure we're staying hydrated. So with this, we can more specifically talk about neck degeneration. So I do have to admit, just in the event if there's someone who is anatomically inclined or another healthcare professional that may call my bluff, so to speak, this first picture here, the one that is not the x-ray, the one that's more like a drawing, is actually of the lumbar spine, which is your low back. But the reason why I use this is because the lumbar spine and the cervical spine, the neck and the low back, actually move and behave very similarly to each other. So anytime you have an issue within the neck, you can also have a similar issue in the low back and vice versa. But even furthermore, I really just like this picture because it shows many different issues that can happen within the disc spaces, and this can also happen within the neck. So I kind of have to tattle on myself a little bit. So if you can see on the first part of that left picture is what a normal disc should look like. The next one down is a degenerated disc. So that's when that disc height starts getting narrow. A lot of times that comes from some sort of trauma, whether it be a macro, something major like an automobile accident, or a micro trauma, again, those small repetitive stuff like wrong size pillow or the work ergonomics, something like that. But when those discs start to get dehydrated or abnormal wear and tear, that's when you start getting that disc height decreasing. So again, this is yet another PSA of if you haven't gone and get your cup of water to drink while you finish listening to this lecture, pause it, go get your water, and then come back and finish, because the hydration will absolutely help with these kinds of issues. All right, are you back from getting your water? Excellent. So moving forward, we've got a disc bulge that also can have an effect on the nerves that come out of the neck. Obviously, your disc herniation is just a worser case of a disc bulge. Both of those can have an effect on neck pain and then ultimately into shoulder pain. And then we talked about, the thinning disc. That's a lot of same thing with the degenerative disc. The thinning is definitely more so like a dehydration issue, whereas the degeneration is more of that abnormal wear and tear, but both of them still require water, so drink your water. And then you go down, and that's where you actually see, it says disc degeneration with osteophyte formation. Osteophyte is just the fancy medical term for those bone spurs that we talked about on the previous slide. So you can see how it's more than just the disc that gets changed and degenerated. It's also the actual bone and vertebra itself. Something to look at. If you notice on this picture, on the right-hand side, you have these kind of holes behind the disc. That's where your actual nerves come out of the spine and then form together and goes down into the shoulder, which technically, again, in this picture, this is where it comes out of your low back and then will go into your hip and then down into the leg and feet. But again, we're talking about the neck here. But if you notice, as you go down the spine and you start seeing all these degeneration patterns, that hole where those nerves come out of gets smaller, gets more narrow, gets more, if we want to use the word, impinged in a sense. And that in turn will also cause derangement and aberrations into your nervous system. That will cause those muscles to not work properly like they should. That will cause pain patterns in the neck and potentially into the shoulder, and not to mention into the arm and into the hands. So you definitely want to be sure that we are evaluating for these degeneration processes. What I like to see is on the other side, this is truly an x-ray of someone's neck, and you can see where the arrows are pointing to is actually that same degeneration process that you can see at the bottom of the left-hand picture. You can actually see it in real life on an x-ray in someone's neck. It's the same thing that is pointed out, but kind of in real time, so to speak. So that way you can actually see what it looks like and something that we would be looking at evaluating a patient. So we talked a lot about the anatomy, all the different stuff that you can find within the neck and the shoulder, a lot of different issues that can arise if any of that anatomy is not up to par, or any kind of biochemical changes that could not be up to par. Now the question is, okay, doc, I have this issue, or I went to my doctor and now I have my diagnosis, because everyone wants to be known for their diagnosis, right? What is there to do? How do I fix this? Well, on the medical side, I always say there's really only three things that ever happen on the medical side: either drugs, surgery, or usually refer out to PT, right? So with drugs, their main things is going to be anti-inflammatory most of the time. So it can be done through injections. It can be done through, actual prescription medication. The problem with that is that oftentimes those medications go into the joint spaces and actually compete and inhibit receptors that are used for healing the cartilage and what is inflamed. So you'll actually end up making the pain worse long term just for it to feel a little bit better in the short term. So again, you can make your decision for yourself, but I would tend to use a more natural approach that we'll be talking about shortly. Sometimes when we get someone who has severe degeneration, with this lecture, we're talking about the shoulder, but sometimes it's the hip. Sometimes they have waited so long to seek help that unfortunately we can try our best, but sometimes surgery may be the only option for them if conservative care just doesn't seem like it's working. And I always hate that because, it tells me they waited too long to really get this treated in hopes that the pain will go away, when they're just the whole time making it worse because they were never getting it treated to begin with. So sometimes you may have to get a joint replacement or something like that. In small cases, that is the appropriate move to make. But again, we try to do everything on our side to prevent people to get surgery, because once you're cut, you can never go back. So we always want to try to do our best on the natural holistic side to keep people away from surgery as best as possible. And then sometimes with the PTs, sometimes it helps, sometimes it doesn't, because ultimately they end up looking at, if you've got a shoulder pain, they're going to look at your shoulder. And sometimes they may only be looking at one or two muscles, and it may be those big group muscles, like I mentioned before, like your biceps or your pectoralis muscle. But as we saw just from those 5 other muscles, that there actually really could be any number of things or a combination of muscles that truly need to be worked on at the same time that sometimes may be missed, or something else completely that's being missed, like say the diabetes, for instance, when we were talking about the latissimus dorsi muscle. So sometimes that's why we see people come into our office saying, yeah, doc, I went to PT, it didn't really seem to help. It may not be a muscle issue, what's going on. And that could be why sometimes PT doesn't really help. So, doc, I've got this issue, and it sounds like I may not need to have surgery, or the drugs and medications didn't really help, and neither did PT. Well, what other options are there for me? So obviously at Roselle Center for Healing, we are primarily a chiropractic office where we do specialize in the applied kinesiology with chiropractic and acupuncture and nutrition and things of that nature. So obviously there's chiropractic adjustments. Any kind of malposition or subluxation within the neck or the shoulder can definitely cause pain patterns. So first and foremost, we would be evaluating the neck and the shoulder and anything else that could be associated with it to see what kind of subluxations are present. And then because of that, there's also muscles that can be attributing to this, as we talked about before, that we would have to work on. Sometimes it is stretching out the muscles that are tight. Sometimes it is neurologically programming or strengthening those muscles that are weak or inhibited, that aren't functioning as optimally as they should. Sometimes there are inflammation patterns. So we did briefly talk about, say, the attended ultrasound, which is a physiotherapeutic. Sometimes it could be, electric stim that's needed, the interferential. Sometimes it could be ionization foot bath if we need to globally get rid of global inflammation. For those who have issues with diabetes, oftentimes they have like a global buildup of inflammation because of the increased sugar intake when their diet is inappropriate. And then obviously sometimes it's exercises, like I mentioned before. If those muscles aren't firing optimally or weak, as the colloquial term is, we may need to strengthen those muscles, or any kind of stretching exercises that may be needed to help rebalance the whole muscle joint relationship within that shoulder. So 2 quick exercises that can be very beneficial for shoulder mobility or shoulder strengthening. One is called your wall angels, and the other one's called a push-ups plus. So for wall angels, we always talk about there's 4 points of contact. You want the back of your hands and your elbows to be touching the wall. Then you also want your rib cage to be as flush with the wall as possible. And then you also want your low back to be hauled out and touch the back of the wall as well. So what you'll end up doing, as you can see in this picture, is when you have all 4 of those things touching the wall, you're going to slowly lift up the hands or slide the hands up on the wall, and then eventually you're going to be bringing them back down, kind of like when you're making a snow angel and on the ground when it's snowing. You're basically doing the same thing but on the wall. And this really helps with opening up everything within the shoulder girdle and allowing and improving shoulder mobility if things are kind of locked up or kind of that frozen shoulder kind of issue. And the second exercise is called a push-ups plus. So it looks very similar to a push-up. So you would be on the floor, you lower yourself towards the floor, and then you push up, and everyone understands what a push-up does, right? The plus comes in with, once you get to the up portion of the push-up, you're doing a little extra, and that's, you're going to kind of push yourself further away from the floor to push the scapula or the shoulder blades further apart. And then before you go down to the floor, you'll retract your shoulder blades to try to bring them together before you go back down to the floor. So the whole purpose of this is less of the actual push-ups motion and more of that bringing the scapula away from each other and toward each other. And this will help work that serratus anticus or serratus anterior muscle that we were talking about previously. And here I listed 3 different modifications to this. So I know not everyone can do a push-up. So sometimes you can just stand up against the wall and push yourself away from the wall. Or once you've mastered that, then you can go on an incline. So like your bed or a couch or like a bench press, like a bench in the gym, that would be a slightly more advanced from the wall. And then once you've been able to master the incline, you can go straight into the floor, which would be like your traditional type push-up. And again, this is to help improve the scapular motion and to strengthen that serratus anticus muscle that we had talked about previously. So with that, I want to thank everyone for listening to this lecture. I know we covered a whole lot of stuff, and we really only scratched the surface of the neck and shoulder pain complaints, really. There's so much more that can be involved with this, but I definitely wanted to hit the highlights for everyone to get the wheel turning, so to speak, get the mind kind of thinking about why someone could be potentially having shoulder complaints and why it may be way more complex and more involved than here. Just take this pill and hopefully it'll be better. So as our gift to you for listening to this lecture, we always work with our charity Caring for Others. It's a 501c3 charity organization that provides health care to those indigent people who cannot afford any type of health care. It also helps provide scholarships to those individuals who want to pursue an education into some sort of holistic healthcare. And it also helps allow us to continue to do these types of healthcare lectures, both, online or back before COVID hit, out in the public, where we can go to different events and be able to have these kind of healthcare lectures as well. So our gift to you is that a donation of $99 to our charity organization, Caring for Others. You get a full orthopedic and neurological and applied kinesiological examination, along with the second appointment, which is a complimentary report of findings consultation. So that's going over everything that we found during that initial orthopedic, neurological, and AK exam. We go over all of that for you and then give you our best recommendation of care. Both of those appointments are valued about $225 for both of those appointments combined. But for a donation of $99 to Caring for Others, you can actually get that full 2-day appointment, the exam, and that consultation free of charge for you by just making that donation to Caring for Others. So again, I want to thank you all for listening to this lecture. And I hope everyone has a good rest of the holiday season and a good rest of the 2020. And I look forward to being able to see and helping as many of you guys as possible. Definitely feel free to reach out to us at the office at Roselle Center for Healing if you do have any further questions, or if you want to take advantage of this donation to Caring for Others, so that way we can help you get your health back on track and help you with any of these kind of neck or shoulder type pains for you. So again, thank you guys and have a good rest of your day.